Today, the latest revelations into a health alert we were the first to raise the red flag about. 5 years ago, we asked the FDA to release information about the long-term effects of corrective laser eye surgeries, which they did. Now we're investigating the disturbing link between suicide and these eye procedures, these surgeries that promise to make your vision go from this to this, but is leaving some people seeing this and in constant crippling pain. And it recently claimed the life of a beloved meteorologist who took her own life 2 months after the surgery.
I'm struggling a little bit, so I do still need all the prayers and the well wishes because this is a hard go. The doctor said it could take up to 3 months or so before I feel like 100% again.
That's beloved Detroit meteorologist Jessica Starr, sharing the pain she was in after complications from a newer Lasik-type surgery. Jessica struggled with poor eyesight all her life. And after the surgery, the mother of two tweeted that her recovery was a struggle and a challenging time. Jessica never recovered. Last December, she took her own life. Her death has raised questions about the disturbing link between laser eye surgeries and suicide as more cases emerge. In October, Canadian TV reported Paul Fitzpatrick, father of two, took his own life, blaming the laser eye surgery he went through back in 1996. In a suicide note, he wrote, "Since 1996, pain, pain, and more pain. Please forgive me for not being strong enough to cope. The past few months have been unbearable." Every year, about 600,000 people get Lasik, many lured by the ads. But a new FDA study revealed Lasik risks were higher than some originally thought.
If you type into Google Lasik complications, you'll get pages and pages. You can never predict when an eye is going to go wrong after Lasik.
Here's what can go wrong. Patients may achieve 20/20 vision on an eye chart, but be seeing that chart in double or seeing halos or starbursts, especially at night. And the most concerning problem of all, dry eye pain. So severe that some people have committed suicide.
All he would talk about was his eye pain and his eyes and how he couldn't live that way, and it eventually cost him his life.
In past investigations, we went undercover to see what Lasik centers tell patients in person.
Could I really toss away my glasses, like the ads say?
You can, yes. Surgery is 15 minutes. Right after that, you don't need the glasses at all.
We have the technology to get rid of reading glasses and distance glasses.
Really?
It's pretty foolproof at this point.
And when we asked about side effects, the Lasik specialists downplayed them.
Are the dry eyes temporary?
It is.
It's not that common. I would say it happens probably less than 5% of the population.
I shouldn't worry about the night vision. Okay.
I never want to say zero, but it's certainly less than 1% chance.
Today, what do you need to know about laser eye surgery? Joining us are Sarah, who wished she'd never had eye surgery 3 years ago, and Paula, a patient turned advocate who says Lasik destroyed her eyesight and left her with chronic pain. We're going to start with Sarah. Why did you decide to get the Lasik procedure?
It was pretty simple for me. I just wanted to wake up and be able to see without glasses and contacts.
So a few weeks after the operation, you started experiencing some symptoms.
Yes, right after the operation, I could see 20/20, I still do, but I immediately had dry eye. It just kept getting worse and worse. It eventually turned into corneal neuralgia, which is basically nerve damage, nerve pain. So I take something every day for the pain. I put in eye drops 8 times a day for the past 3 years.
So it's important to know some of the risks of Lasik. There's the dry eyes and the pain that Sarah just described. There's also visual aberrations like seeing double, which looks like this, right? Or glares. And glares, again, like looking at the sun, but it's not really the sun causing this. There's halos, so you'll see little rings around lights. And then there's starbursts, which are especially problematic if you're driving. Sarah, were you informed of any of these risks?
I remember when I was reading my consent form, it said something like 1% chance patients get dry eyes, and then it listed the things you just listed, but I had no idea what that was.
The 1% complication rate, which was also in that little tape piece, said to us by a doctor, is what I had always heard as well. We're going to challenge that number for good reason. I don't think anyone really believes that number anymore.
No.
But the issue that really got my attention was the pain that has led to, we believe, suicides and life-destroying challenges.
Yes.
How bad is your pain, Bid?
It's really hard to explain if you don't have it, but it's this burning, deep, intense pain. It's kind of like there's like a toothache in your eye, and it's not something anybody would want to live with.
I understand you've considered some drastic measures because of it.
I completely understand someone wanting to kill themselves over it, because when I was at my worst, I told myself if I don't get better, if I don't find a way to get rid of this pain, I don't want to live anymore. How can someone live like that?
So you're not the only person we spoke to, obviously, Sarah. We spoke to a lot of folks. Others have experienced the same excruciating pain. One woman we spoke to lost her eye as a result of this surgery. And I want to get Paul into this conversation. You had your LASIK surgery 18 years ago.
That's right.
And you've been living with long-term side effects from that procedure.
That's correct.
Let's start with your vision. Is it 20/20?
My vision, if I sat down and looked at an eye chart in a doctor's office, I might be able to make out the 20/30 line with both eyes open, but my vision was a complete train wreck. Massive starburst, halos, multiple images. I could look up at the moon at night and see up to 8 smeared, overlapping moons with a massive halo around the whole thing. It was just ghastly. Mm-hmm. And that was considered as a success.
And were you warned at all about these complications?
I was given a single sheet consent form, front and back, and it listed a lot of different complications that could arise. But it never said anything about permanent, chronic. Those words were not used. Everything was dismissed as temporary side effects. It'll get better, give it time. No one ever told me that I could be visually disabled for life.
So what do you want people watching right now to know about what you went through?
I want people to understand this surgery is not as safe as it is